Hello everyone, welcome to the new session of Symptoms of Common Diseases in Cattle Part 2. So in this session, we are going to cover these particular types of diseases, that is rinderpest, one of the very common disease in cattle, listeriosis, mastitis, foot rot, very common, and bovine rhinotracheitis, piglet diarrhea or scour. So these particular diseases we are going to cover in this particular session. So let us start with this session with first disease, that is rinderpest, that is cattle plague. Rinderpest, also known as the cattle plague, is a contagious viral disease affecting cloven-hoofed animals, mainly cattle and buffalo. So this particular disease occurs to the cattle and buffalo, and they are affecting the cloven-hoofed animals like cattle and buffalo. In 2011, rinderpest became the second disease to be declared officially eradicated following eradication of the human disease smallpox in 1980. So as it was declared that human disease smallpox has been eradicated in 1980, in the same way in 2011 it was declared officially that rinderpest disease has been eradicated. So this is one of the very important point from the examination point of view. Rinderpest is caused by a virus. So this particular disease is a viral disease. It's caused by Paramyxoviridae family, and the genus is Morbillivirus. So this is a virus and this is the family of this virus. Mainly species of the wild and domestic cloven-hoofed animals, including sheep and goats, show only mild symptoms of the disease when infected. But for the cattle and buffalo, mortality rates can reach up to 100% and in highly susceptible herds. So the herds or the group of animals that are susceptible to this disease, the death rate can reach to 100% in the case of cattle and buffalo. So they are more dangerous for the cattle and buffalo. Okay. But for the sheep and goats, it is not so harmful. Okay. Only mild symptoms can be seen in the case of sheep and goats. The OIE, Terrestrial Animal Health Code, contain detailed recommendations on the prevention and control of rinderpest in the event that there is a reoccurrence of the disease. So there is a chance of reoccurrence of this particular disease. Rinderpest is one of the 7 diseases for which the OIE had established official recognition for the sanitary status and procedure for countries and zones. So the zones and countries, different sanitary status has been established. Okay. Rinderpest historically occurred in Europe, Africa, and Asia. The America and Oceania never faced rinderpest epizootics, and infected animals that recovered from the rinderpest have lifetime acquired immunity. So there is a lifetime acquired immunity to the infected animals once they are recovered from this particular disease. The past vaccination program led to a continuous decline in the prevalence of the rinderpest in the world. So there is a vaccination program against this particular virus so that there is a continuous decline in the prevalence of the rinderpest. Classical sign of the disease. So let us discuss about what are the classical signs of this disease. In the cattle, the most susceptible species, classical sign of the disease include fever, erosive lesions in the mouth, though there can be seen in lesions in the mouth, discharge from the nose and eyes. So there are lots of discharge from the nose and eyes, profuse diarrhea and dehydration, often leading to the death within 10 to 15 days. So there is so much diarrhea and dehydration in the body that can lead to death even within 10 to 15 days. In other species, rinderpest may show milder and clinical sign. So in some of the other rinderpest species, there are milder clinical signs. Disease diagnosis. The clinical sign, especially milder cases, do not point specifically to the rinderpest. So when there is a milder cases or there is no particular sign of the rinderpest, serological tests indicate whether the animals have been exposed to the virus. So when there is a serological test, then only it is exposed that the cattle or the animal is exposed to the virus. While definitive diagnosis is based on identifying the virus from the blood or tissue. According to the standard in the OIE, Manual of Diagnostic Tests and Vaccines for the Terrestrial Animals has been done. Disease spread. Rinderpest is spread by the effective contact between animals carrying the virus and susceptible animals. So, they are spread from one animal to another by the effective contact. Okay, so they can be spread from animal to animal. So they can be spread to the susceptible animal, the ones the animal is having immunity, okay, or the vaccination, that do not get affected with that. But once the animal is susceptible, they can easily infect to them. The virus is found in nasal secretions a few days before any clinical sign appears. So before the clinical sign also, there is a nasal secretions in the case of animals. And virus can be found in those secretions. As the disease progresses, the virus is found in most body fluids and either death ensures or the animal recovers, develops immunity and clears the virus from the body. So once the disease is spread to all the body, this particular virus can be clinically diagnosed in all the fluids, and that also ensures death. And when the animals recovers from this particular disease, there is no sign of virus in the body. Okay. Other than cattle and buffalo, rinderpest can infect water buffaloes, African buffaloes, eland, kudu, wild beast, various antelopes, bush pigs, warthogs, giraffe, sheep and goats. So they are not only infected to cattle and buffalo, but they are infected to so many animals. So this is so dangerous. Rinderpest. Some wild animals can carry the virus without showing sign of disease, and in few cases have made contact with the domestic animal population, leading to the reintroduction of the disease. So sometimes the wild animals, okay, so they do carry these particular virus without showing any sign of the disease, and they sometimes get contact with the domestic animal population, and at that time they introduces that virus to the domestic animals. Disease control. How to control this particular disease? OIE member countries agreed to follow the guidelines for the safe storage and the destruction of any remaining rinderpest virus under the strict biosecurity condition. Measures control rinderpest in animals include. So these are certain measures that should be used to control rinderpest. Movement control. So we should control the movement once we get ensured that this particular cattle or animal is infected with the rinderpest. So there must be movement control of that particular animal. Destruction of infected and contact animals. So there must be destruction of infected and contact animals. Disposal of care cases and infective material. All the infective material should be disposed of. Sanitation and disinfection should be done properly so that it could not spread to other animals. Next disease, the second disease is the listeriosis. How it is transmitted. The organisms are excreted in the feces, urine, aborted fetus, uterine discharge, and the milk of infected animals. So once the animal is infected with this listeriosis, its milk is also infected along with its feces, urine, aborted fetus, and uterine discharge. The organisms are sufficiently resistant to remain viable in animal and human feces, sewage, soil, silage, and the dust for several weeks and months. So this organism are sufficiently resistant and remain viable in animal and human feces even. The blood-sucking arthropods may spread infections since organisms have been isolated from the cattle ticks and tapered flies. So there are some flies and some cattle ticks and even the arthropods. Okay, so these are the category of arthropod, that is cattle ticks and tapered flies. These are all arthropods. They are blood suckers. Some are the blood suckers. So they spread the infection. They can move from one animal to another and they can spread this listeriosis. Under the natural conditions, certain predisposing factors are related to the clinical infection. Now, what are the symptoms? In farm animal, the disease occurred toward the end of the winter or early spring. So generally, this particular disease occur at the end of winter or early spring. The first sign of meningoencephalitis or stiffness of neck, incoordinated movement of limbs, and tendency to move in circle or lean against the fence or wall. So these are the symptoms. What are the symptoms? Sign of meningoencephalitis, stiffness of neck. The neck becomes stiff of these particular infected animals. Incoordinated movement of limbs. The limbs do not coordinate properly, okay, when they walk, and tendency to move in circles. So generally they start moving in circle and sometimes they could be found leaning against the fence or wall. So these are some of the early symptoms. There may be paralysis of muscles of jaw and pharynx, incoordination between the progressively more severe until the animals can no longer stand. So in severe infection, what happened? The animal becomes so infected with this. In severe infection, the animal could not stand on its leg. Okay, and there is a paralysis of muscles in the jaw and pharynx, so they cannot eat it at that level. The cattle which are not severely affected may survive. So sometimes some animals are not severely infected, so they can survive. But when there is a paralysis of muscles in jaw and pharynx, or sometimes they could not stand on their legs, so these are some of the severe infection level. So at that particular time, they could not survive. Abortion in cattle usually occur after 4 to 8 months of pregnancy and comparatively later stage in the sheep. So once there is a pregnant cattle, and they are infected with this listeriosis, then after 4 to 8 months there is a abortion. There is an abortion in the cattle. In pigs and horses, clinical signs are not commonly but may develop as encephalitis and septicemia. So in the case of horses and pigs, there is no severe sign or a clinical sign of this particular disease, but encephalitis and septicemia is commonly seen. In poultry, the disease usually causes sudden death, and occasionally there is a sign of torticollis, weakness and incoordination of the leg. So they are infectious to the poultry also. Third disease is the mastitis. Mastitis, or the inflammation of the mammary gland, is the most common and the most expensive disease of the dairy cattle throughout most of the world. So very important, and this is one of the important aspect from the examination point of view, that this is the most expensive disease of the dairy cattle. So the question can be asked from this particular breed, this particular disease. Although stress and the physical injury may cause inflammation of the gland, infection of invading bacteria or other microorganisms like fungi, yeast, and possibly viruses is the primary cause of mastitis. So, stress and physical injuries are the main cause of the inflammation of the gland. Okay, but there is some infection by invading bacteria and other microorganisms like fungi, yeast, and possibly the virus. Okay, infection begin with microorganism penetrate the teats, canal, and multiply in the mammary gland. So from the teats of the nipple, these microorganisms get penetrated inside and they multiply in the mammary glands. Now, what is the treatment? Success depends on the nature of the etiological agent involved, the severity of the disease, and the extent of fibrosis. So, our treatment depends upon how the disease is severe. Okay, severity of the disease that decides. Complete recovery with the freedom from the bacterial infection can be obtained in the case of recent infection. If it is recent infection, then there is a complete recovery. And in those where the fibrosis has taken place only to a small extent. And when there is a fibrosis, then there is a small extent that this particular disease can be recovered. Such drugs as ecreflavin, gramicidine, and tyrothricin have not now ceased to be in use and have given place to the more effective drugs such as sulfonamides, penicillin, and streptomycin. So these are some of the drugs which are used in the treatment of mastitis. Okay, so next disease is the foot rot. This is also one of the common disease in the case of cattle. Foot rot is a common cause of lameness in cattle and occur most frequently when the cattle on pasture are forced to walk through mud to obtain water and feed. However, it may occur among the cattle in paddocks as well as under preventively excellent condition. Foot rot is caused when a cut or a scratch in the skin allows infection to penetrate between the claws or around the top of the hoof. So when there is a cut or a scratch, okay, in the skin of the hoof, then there is a chance of this particular rot in the foot. Individual cases should be kept in dry places and treat promptly with medications and directed by a veterinarian. So whenever there is a chance of this particular disease, so we must contact to the nearest veterinarian and follows whatever the treatment he says. The disease becomes a hard problem of a foot bath containing 5% solution of copper sulfate placed where cattle are forced to walk through it once or twice a day will help to reduce the number of new infections. So when there is an infection, what we can do, 5% solution of copper sulfate placed where the cattle are forced to walk. Okay, so where the cattle are walking, we can place this particular solution so that it can heal those rotten part. Okay, and they are forced to walk them twice a day and help to reduce the number of new infection even. In addition, drain mud holes and cement areas around the water troughs where the cattle are likely to pick up the infection. Keep pens and areas where cattle gather as clean as possible. So wherever the pens or the areas where the cattle are kept, they should be sanitized and they should be cleaned properly. Proper nutrition regarding the protein, minerals and vitamins will maximize hoof health. So we must provide a proper nutrients regarding the protein, minerals and vitamins so that health of the hoof can be improved. Next disease is bovine rhinotracheitis. Infectious bovine rhinotracheitis (IBR) is a highly contagious infectious respiratory disease that is caused by the bovine herpes virus 1. So this is the virus that causes this respiratory disease, that is bovine rhinotracheitis. It can affect young and older cattle. In addition to causing respiratory disease, this virus can cause conjunctivitis. So this is not only affecting the respiratory part, this is also affecting the eyes and causes conjunctivitis, abortions, encephalitis, and generalized symptomatic infection. So this is one of the very harmful disease to the cattle. IBR is characterized by acute inflammation of the upper respiratory tract. So there is an acute inflammation in the upper respiratory tract. Now what is the treatment? There is no direct treatment for the viral disease. This particular disease has no direct treatment. Infected animals should be isolated from the rest of the herd and treated with anti-inflammatory drugs and antibiotics for the secondary infections if necessary. So first of all, the infected animal should be isolated so that it could not spread the disease to the rest of the herd and treated with anti-inflammatory drugs and antibiotics even. Carrier cattle should be identified and removed from the herd. So there are some carrier cattle also. Okay, so that carrier cattle means the cattle that are exposed or that got contacted with the diseased one. So they become carrier. Okay, so that also should be identified and removed from the herd and they should also be kept isolated. Prevention. Control of the disease is based on the use of vaccines. So if there is a vaccine, we can control this particular disease. Next is the piglet diarrhea or scour. Of all the disease in the sucking piglet, diarrhea is the most common and probably the most important. So this particular disease is one of the most important disease in the case of piglets. Okay, and in some outbreak, it is responsible for high morbidity and mortality. So when there is an outbreak of this disease, it causes a high mortality rate of the piglets. So this disease is caused by E. coli and Clostridia. So these are the two bacteria that causes this particular disease. And the main parasite is Coccidia. So this is a parasite that spread the disease. Clinical sign. Scour in the piglet can occur at any age during the sucking, but there are often two peak periods, that is before 5 days and between 7 to 14 days. So there is a peak period of this particular disease. Acute disease. The only sign may be perfectly good pig found dead. Post-mortem examination shows severe acute enteritis, so sudden that there may be no evidence of scour externally. Clinically affected piglets huddle together, shivering or lie in a corner. So when they are affected piglets, they could be found shivering or they can lie in a separate corner. The sign around the rectum and the tail will be wet. So around the rectum and the tail region, you will find that they are always wet. And look around the pen of evidence of watery to salad cream consistency score. So this score, that is of the watery to the salad creamy, could be found in the pen region. In many cases, there is a distinctive smell. As the diarrhea progresses, the piglet becomes dehydrated with sunken eyes and thick leathery skin. So their skin are affected, their eyes is affected, okay, in severe dehydrated condition. The scour often stick to the skin of other piglets, giving them orange to the white color. So in this way, it can spread from one animal to the other. Prior to death, piglets may be found on their sides, paddling or frothing at the mouth. The symptoms are similar but affect the piglets are less dramatic, more prolonged, and mortality tend to be lower. In the subacute disease of this particular type, there is a lower mortality rate. This type of scour is often seen between 7 to 14 days of age, manifest by the watery to thin salad creamy consistency diarrhea, often white to yellow in color. Management, control, and prevention of this disease. Adopt procedure to prevent the spread of the scour. Disinfect boots between the pens. Use of disposable plastics apron when dosing piglets to prevent heavy contamination of clothing. Wash hands after handling a scoured litter. Disinfect brushes and shovels between pen. So the first thing is very important, that in disinfection of the boot place or the pens, so that it could not spread to other. Ensure that farrowing house are only used on an all in all out basis with a pressure wash and disinfection between each batch. So we should give emphasis to the disinfection between each batch. Farrowing pen must be dry before the house is repopulated. Once it is disinfected, the farrowing pen must be dry once it is repopulated. Remember that moisture, warmth, and waste food feces are ideal for the bacterial multiplication. So, bacteria can multiply when there is a moisture, there is a warmth, or there is a leftover of the foods. So that should be eradicated, that should be cleaned, disinfected, and dry before repopulated. Pen floor should be well maintained. These floor, where is the place to keep the animals, that should be well maintained. Poor pen hygiene associated with the bad drainage predisposed to scour. So this particular disease can spread if there is a less of hygiene and bad drainage system. Look carefully at the part of the pen floor where there are piglet feces. Is this poorly drained? We ensure that if there is poorly drained, do large wet patches develop? If so, cover them with the extra bedding daily and remove. This is the most important aspect of control. So this is the way we can control. Check nipples, drinkers, and feeding through for the leakage. Ensure that feces are removed daily from behind the sow from the day she enters the farrowing craters until at least 7 days post farrowing if the floors are slatted. So the feces are removed every day. If the feces are there, then there is a chance of multiplication of the bacteria. And that particular feces do contain those bacteria that can spread from healthy to the healthy animals. Also remove feces daily throughout the lactation if they are solid concrete. Maintain creep environments that are always warm and comfortable. So we should also keep the environment that is warm and comfortable to the animal. Fluctuating temperatures are the major trigger factor to scour, particularly from 7 to 14 days of age. So if there is a fluctuation of temperature, then there is a chances of scour. Assess the environment of all the farrowing houses. So proper maintenance of temperature is important. Poor environments allow heavy bacterial multiplication, and a much higher bacterial challenge is likely to break down the cholesterol immunity. Check the source health. Animals affected with enteric or respiratory disease, lameness, or mastitis predispose the litter to scour. Where farrowing house floors are very poor, pitted, and difficult to clean, brush them over with the lime wash and containing the phenolic disinfectant. So where the floors are pitted, okay, so at that places we can brush them over with the lime wash containing phenolic disinfectant. Colostrum management. It is vital that the piglet receive the maximum amount of colostrum within the first 12 hours of the birth. So this is the first milk that a pig provide to its young ones. That is the piglet. Okay. So within the first 12 hours of the birth, high level of antibody are only absorbed during this period. So factors such as poor teats assess, poor crate design, and particularly the development of eclectica in sow associated with udder oedema reduced to intake. So if there is a poor teat assess or the poor crate design, okay, and also the particularly the development of eclectica in the sow, then it can reduce the intake of milk. Okay. So this is all about this session. We will have one more session to complete this particular topic. Thank you very much.